All right. While we see if Deanna and Sheila are going to log on, let's go ahead and we're going to do a quick pyramid with some parallel breaths to get us all in alignment for today. So go ahead and get comfortable. And we're going to go ahead, and we've already created a freestanding pyramid. So as you connect down into the earth and you just bring that energy up all the way, the legs, the pelvis, curves of the back, up the skull. And because we have this pyramid already standing, we can go straight into that. And here in this pyramid, we can take that deep breath where we've all come in from a busy day. And just relax and know that we're among family and friends, and that we're in this class to not just learn, but to have fun, to learn with ease. And while we're here, let's just go ahead and make it a pyramid of healing, which means you can add yourself or anyone else or the world. And while we're all here together in this pyramid, let's just do some parallel breaths right now together. And let's start from the crown and breathe down and then back up. Before we return, let's remember that we're a great herd of donkeys that can lean on each other and be open, honest, and ask for what we need and offer support. So let's go ahead and let's drop that line of energy now through the crown chakra and the brow and the throat and the high heart and the heart, the solar plexus, and the pelvic and the root. And before you come back, give yourself a little nod of gratitude for showing up to learn how we can research and expand our knowledge of zero balance and to share it with the world. And when you're ready, join us. Hi, Sheila. Hi, Deanna.
Hello.
I hear you've been in a class.
Yeah.
Right.
And then I had a client, so I haven't eaten supper. Lauren's going to grab me some supper and I'm going to turn my screen off and eat. Sorry, but
No,
No, it's fine.
do that.
Understood.
multitasking. Good to see everybody.
Good to see you.
Okay, so one of the things that Mary and I wanted to just make sure to emphasize, and that I think helps people relax into what we're doing, is that it's just an introductory class. So what you're learning here is an overview of research, an overview of noetics. And if you want to think about that as like taking that intro to ZB class, just kind of whet your appetite at what you can learn and do. And yeah, I mean, research, like any other skill, right? It takes mastering. It's like that muscle that you have to keep working out. But it's really fun to do it as a group or with the support of other people. I think Mary now is going to lead our investigation into the articles that we asked you to read.
Yes, so we didn't have a lot of time in week one. We covered a lot of ground. And right at the end, we had time to ask everyone to comment on the 3 articles, particularly anything that jumped out for you. And this is just to help us learn how to read an article well and tease out information about whether or not an article feels like it's useful, has a solid design, are the findings that they report, can you see how they got them? What do you think of their conclusions? So it's really just an exercise in paying attention. Research articles can be a little dense to read, and we've shared with you resources about the different parts of a study. And so you can always go back and look at that resource from the National Institute of Health. But I want to just open up the discussion and to remind us where we left off last time. I know, Veronica, you had made some comments, and Misty, you had too, but I just want to open the floor. Would anyone like to summarize again things they noticed, things that made sense or didn't make sense? So feel free to raise your hand or just jump in.
Could I make a request that we do it article by article?
Absolutely.
Thank
Yeah.
you.
So let's start with the massage therapy and quality of life and osteoarthritis of the knee is called a qualitative study.
I had lots of thoughts, but
Go for it, Veronica.
well, I mean, I certainly appreciated that they were able to demonstrate that massage or that it was beneficial for the people experiencing OA. I have lots of thoughts. I don't know how many you want me to share, but anyway, so I was really happy with the results. That's the bigger picture. But I had lots of questions about the article itself.
Mm-hmm.
I think, first of all, what was really challenging for me was that they combined their previous study about what they call the dosage. They combined it so much with this article. And so it was hard for me to sort of go back and forth. They're giving results from the other study, then they're giving results from this study. And so that was a huge issue for me.
Mm-hmm.
And I think that there were, so I have to think, I'm sorry. One of the things too that they really didn't talk at all about was exactly how they got their subjects. So there had been this previous study that everybody was involved in, and there were 125, I think, of those subjects, and then 18 that they actually interviewed for this qualitative study. And it wasn't at all clear to me how they actually got those from the 125 down to 18. Another thing that was really They didn't say at all when. They interviewed these people, and their first study was on the dosage. That was also interesting that they called frequency and duration of massage a dose. But anyway, they did that study, I think, in 2012. And this study they published in 2017. And so I have no idea when in that span they interviewed those people. And so how long from the time that they were actually receiving the treatments were they doing this interview? So that was a big question that I had. I think that, I mean, you record everything when you're doing your qualitative studies. This was just, and I think that was another thing. Some of them were interviewed by phone. Some of them were interviewed in person. I think that that's a huge difference. They were mostly female. And so I think that the subjects that they did for the qualitative study was a very skewed group of people. And also I think it was clear that they were all female. But one of the other things that was interesting to me was most of them were in the obese range. And I don't know if that was the same demographic of
the first study.
125.
Mhm.
And then I thought a lot of their write-up was just not clear. And I mean, they would do comments about one person said this or one person said that, and then they would make references to where they were in the arm. And was that important or not important? But that was back about the other study. And so that sort of going back and forth was challenging for me. So I probably could say more, but
Yeah, no, but
starters.
yeah, no, that's excellent. And just to everyone else, we know that she has research background, which is great. And you can see that in her ability to pick out these different problematic areas of the study. So when the rest of you hear what Veronica just shared, what comes up for you? Sacharn.
Okay, so I think this is carrying forward from what Veronica said. I didn't review my notes, and I read these 2 weeks ago, but my notes, if I remember, and they're helping me remember, I don't think they recorded these interviews. I think they were done
They didn't.
live. And so there was the factor of bias involved, the interviewer bias, which to me was, jeepers, why didn't they record them? I mean, that was kind of silly. That would be simple to eliminate interviewer bias that way. And then at the end, probably the end, they did somewhere along the line clarify the paradoxes and the biases that were included in the study, which I appreciated because I don't think the Reiki article did. I just didn't pick them up in the other two, that the researchers identified, well, okay, well, we could have done this differently and this is why, and that kind of thing. And then I was happy. I was glad that they didn't consider comorbidities. They tried to eliminate, if I remember, they tried to eliminate morbidities in this one. I was glad that they included an ethics statement. The Reiki one, I didn't pick up an ethics statement, and I did read the Reiki one first, and it was just so loose that I was like confused and pissed off, and what, I don't want to read one of those again. But that may be in talking with a friend who has done research and his livelihood. Now, what did he say? It was something about, oh yeah, so I'm wondering about how much translation science experience is going to be needed. Translation science experience. How much do I need to understand about terminology, nomenclature, all of that? I mean, I really want the English to jump right off of the page at me. So there must be a filter that I can learn to filter out some of this jargon so I can actually understand, when we get into some really scientific meaty stuff. Because I'm an English major. I love biology, but I'm more about the written word.
One quick comment, Sacharn, and then Rhonda is next. Thank you, Sacharn. I would say a tip for me is when I'm reading something, if I come across something I don't understand, I immediately make a note of it and look up, look up the definition, because otherwise I just stumble forward without really understanding what's being described.
I did a lot of that, Mary.
Yeah. Well, I still do too, Sacharn. So
Good to know. Good to know. Thank you.
Rhonda.
I rated this article the worst, in my opinion. It was a snooze fest. I had a hard time staying awake actually reading it. A lot of things bothered me about the articles. I'm used to reading articles in terms of would I change my practice, and my result at the end was no. I didn't think it was effective enough for me to, if I treated this population, I don't think I would have changed my practice habits. It was very vague. They start out like details that bothered me, where they start out saying Swedish massage and then they generalize to just massage after that. Are they still talking about Swedish massage, or are they talking about something different? And that's what a lot of these articles like this, like when articles also talk about Tai Chi. I don't even know how many variations of Tai Chi exist, but in the like scientific world, we have boiled it down to Tai Chi as if it's all the same. So details like that bother me. Some of the other sort of gut reactions I had were like the affordability of it, I guess is what they were calling it, or the availability of it. And this is also a discussion that I have with patients all the time. There is a difference between medically necessary care, which your insurance company is going to cover, and a wellness benefit. And so those things were also, I wasn't sure what the point was. Were they trying to prove to an insurance company that this is medically necessary so that they could get coverage for people? Or were they just making a statement that it's not available because of insurance coverage? People didn't either have the means or they didn't feel like paying out of pocket. So there were two categories of patients, and that is that their people were handpicked. And my last statement was that I felt a little flip at the end. Would you go to a surgeon who was 40% effective? That wouldn't be my first choice. So that was kind of like where I sort of fall when I'm reading these things. But I thought it was just much too vague in general.
Thank you. That
particular taste.
Yeah, no, great. Thank you. Deanna.
Rhonda, I also rated this one the lowest of the 3 articles. And I had a lot of similar comments to you, but one of the things that felt like it didn't really answer the abstract. It felt disconnected with the information, and there were too many vague things in it for me. Like, for example, they made the assumption that stress reduction equals relaxation, but they never really defined things and how they were going to measure it. And my first response is, why weren't they using a pain scale or some kind of wellness inventory? And I realized that is my old pattern of how research, the gold standard of, you have to measure everything. And at the same time, measuring is helpful sometimes to have a numerical pain rating versus, oh, it hurts. So the sample size 18, that's not too bad, but it felt like they were hand selecting the people to kind of get their best results is what my impression was. And the whole conversation about dosage and all this other information, it felt like they had too much information. They were just adding in all of this stuff to like throwing it all in. And I felt like less is more, and they had way too much. They could have broken it up into several articles if they wanted to talk about some of those different aspects. And the other question I had is what constitutes as original research? That was at the top of it. And so that was a question I had, is what does that mean? I don't understand
Mhm.
that particular terminology. And the other comment I had here is it didn't feel like there were clear correlations. Oh, I already said that, between their kind of question and their objectives in this study. So I wasn't really impressed with it.
Thank you. And Jared. Jared, I think maybe you'll be the last one on this study. Misty, I want you to comment before we go to the next one too, if you would. Go ahead, Jared.
Yeah, I could echo a lot of what other people said. I did feel like the overall tone was more palatable to me than the one of the other studies. So, I didn't have like a negative opinion of it, just kind of on the head from its tone. There was distracting definitions for me. Like when they said massage was given bi-weekly, the dictionary definition of bi-weekly is either twice a week or once every other week. So I don't know, the bi-weekly thing is a pet peeve of mine, but it certainly caught me on this one. Also, they had this whole discussion about the accessibility of massage in the beginning, and it wasn't till the end that they sort of defined what that meant. So there was a bunch of like confusion that hung on until all the way at the end of the study. Also, the population was almost exclusively white, which was not really called out as a possibility of like, oh, could this have an effect if, how does the Latino population experience massage versus African, there's all of those aspects that weren't really called out. And yeah, very much agree with 56% of the population didn't experience relaxation or a positive mood outcome. And their tone was extremely like, massage is great, So it just felt, really disconnected from what their results were.
Yeah. Good, thank you.
I think that's all I had. Yep.
Misty. Oh,
wait.
Claire, sorry.
Oh, unmute. Yeah.
Wait, sorry. So just a couple things really quickly. It's been a while since I read this and I did take notes, but I thought the interview questions were kind of like mushy. Like they weren't specific enough for me. And what really bugged me was trying to follow the last couple paragraphs, which was about like making concluding statements. And I was like, huh? How can it be that you're this and you've rated something in a scale that's totally different from what you said you felt? So that bugged me. And I think that's all I want to say, that everybody else has said all the other stuff I was thinking too. So thank you.
Thanks, Claire. Misty.
First of all, Deanna, original research is the same name as primary research. So that would be research that you conducted and discovered your own findings on. I did not care for this article. And the first thing that I caught in the study design was they picked people they believed to be articulate. So I don't know if I would fall into that. You know what I mean? Like what does that mean? So that you did handpick people. I did not like that they presented it as a qualitative study, but kept referring to quantitative things back and forth. I mean, just say mixed methods or something. I didn't like that. It did not say they recorded, but if you read under data analysis, they said the transcripts were analyzed. So that would infer that they did record at some point, but did not tell you that they did that. If they didn't, and the transcripts are just the notes of what the person, wrote down at the time, that doesn't feel good at all. Yeah, I just thought it was not well done. And I mean, I'm gonna say this, it's gonna be on a recording, so I probably shouldn't, but when you were talking about how well, 40% of the people didn't feel relaxed, right? Well, there was a finding that came out about zero balancing. This is before I really got too involved. And the finding was like, well, there was 61% stress reduction or something like that. And I remember thinking, that doesn't do it for me. Right? There's too many people not feeling stress reduction then. I did not feel like that was a number we should be touting. That's not much more than 50% in my mind. So it's how, yeah, it was how it was presented for this study. And it is something that you have to think about, right? We tore this study apart. So when we're designing studies for zero balancing, all of these things that we just tore apart in this one, we need to make sure, right, that we have covered these parts so that we're not having other people shoot bullet holes through our research. So that's why it's important to think about your methodology. And I will say, I do not feel these people knew the audience of which they were writing. And that's why it feels so disconnected. They had no idea of whom they were writing to. And so I feel like they just threw stuff in hopes that it would reach somebody somewhere. That's all I have to say.
Thank you. And you guys are seeing what is arising from just everyone's observations about where they felt the study was not clear. And again, this is just an exercise. Let's go to the Reiki article about the blood cell, changes in blood cell. Anybody want to comment on that?
Real quick, I was lost. I didn't like it. It took me hours to get through it because I had to keep going away from it, coming back, and I almost didn't finish it. Done.
Mary?
Mary.
I can understand that, Sat Charm. There was a lot going on there. I had never heard of this dark field microscopy, so that fascinated me. I didn't even know that was a thing, so I thought that was super cool. And I liked how they combined that with that PANIS scale, because I'm familiar with that. I tried to use that in my work, but I couldn't figure it out. So I'd love to talk to somebody about that if you guys are familiar with that scale, the positive affect, negative affect scale. Because that's used in the vestibular world a lot. So I thought it was really cool to combine like a biomarker with a measure for anxiety and depression. I thought that was super cool. I did get lost with the statistics. It kind of makes you go cross-eyed a little bit. So I had to just try to step back and take a big picture and read it. I'd love to show it to my husband. I mean, they've got box plots. I mean, I was so impressed with this person, an individual clinician doing all this stuff. What the heck? I mean, I was really impressed, and it sounds like she has a private practice. So to me, I just thought, wow, that's amazing to have such a super high level of sophisticated measurement. It looked like a good study to me, but others with more research experience could speak to it. So I'd be curious to see what others have to say. And I wonder who her audience is, because it's pretty scientific. So that's all I have to say. Yeah.
Thanks, Mary. No, those are good points. And Claire, I think, was next.
So I actually liked the study in that it went right to the cellular level. That just juiced me. But with both practitioner and volunteer looking in real time at the blood sample, that seemed like it would taint results in some way. We know, I mean, more observer effect in action. So it was like, well, anywho. But I liked that it was going to that level and looking at that level and seeing what changes biologically were happening during Reiki. It was just cool. Like, wow, that's in depth for sure. So anyways, that's all I had to say.
Thanks, Claire. And Rhonda and Sarah Elizabeth next.
This one was a little more intriguing to me. because it felt more scientific. However, they do talk, I think, in the article about the skill level of the single practitioner, that it may not be reproducible with other practitioners, but in general, my summary was that this was a little bit more effective than the other one. The descriptions were more specific. I thought it was interesting. I thought it was clearly written. I liked the science of energy feel to it. I understood the treatment method being discussed. I was interested in that they were using the blood samples, but admittedly, I'm not familiar with the method of analysis and didn't know whether this was a valid thing to look at or not. I would have to look into that further, and I did not. But it was good to be interested and aware of my own lack of knowledge to leave room for doubt, but I didn't fall asleep. It kept me interested the whole time. And I've seen other research studies that used biomarkers where they looked at cells through slides after a meditation study. So I think where it felt familiar to me in that, except this one was, they almost boxed themselves in a little bit too much, because there was references to this particular skill level of this particular practitioner. So, but yeah.
Thanks, Rhonda. That's good. That's good. And Sarah Elizabeth?
Yeah, as I was reading through this and looking at the charts and the diagrams and how they were laid out and trying to learn about what I was seeing first of all, and then the comparisons between what they were presenting, it was like it was really overwhelming, and you had to dive into the descriptions in order to get a sense of what you were seeing. And I think there's also a sense of needing to understand the statistics and how those diagrams and how the charts were presenting, because it was really like, okay, here's something that looks kind of like a spread out thing, and here's something that looks like a different spread out thing, but I couldn't tell you what was saying what compared to the other. It just didn't elucidate to me what they were trying to get across.
Thank you. Yeah.
It was confusing.
Veronica?
Oh.
You're muted.
Sorry. So it was mixed for me. There were lots of things that I thought were really interesting. Part of the things that I didn't understand, I thought were just my lack of knowledge. And that sort of raises a question as to how much should an article really be able to address, a wide audience picking up, or is it okay that it's very specific to your audience? And I guess, if you're publishing in different journals, that sort of specifies that you have some knowledge, I guess, but it just kind of, I think one of the overall things for me was that it was really interesting to know that there were differences in the mobility or spatial relationships or whatever, but I would have liked to have known the significance of that and the implications. And so, like, I don't know anything about mobility of red blood cells, and how is that important? And then sort of in a practical way, their controls, they had 71 volunteers and 11 controls. And they really don't talk, they said the controls didn't receive treatment, but it didn't say anything of what the controls did during the time that the others were being treated.
Good point.
So that was a big question that I had. And I guess other things, like they said, their hypothesis was that it would show a difference. But it doesn't say that it would show a difference in terms of the Reiki. And so it's very confusing. Have these methods never been tested before in terms of being able to show before and after changes? So that was murky to me. And then there was just some things that I thought were just a little bit sloppy in their writing. Like at one point it says that the samples were taken immediately after Reiki. In another place it says that was taken 30 minutes after Reiki. And I think that they meant after the 30 minutes, but the way they wrote it said it was 30, I mean, it literally says 30 minutes after Reiki.
Yeah.
So when people are sloppy in their writing, it just makes me sort of think, well, what else that I don't know about this is also sloppy.
Yeah.
And I think that I think that's mostly what I would love to have known more about the significance and the importance of their findings. Yep.
Good, thank you. Jared, and then I think we'll probably move on to the third article.
I just wanted to say quickly that I started reading this study and I felt really kind of irritated and pissy, a little bit like Satcharn maybe. And it felt like they were making really bold, large claims and they weren't backing them up well in the beginning. One of the first ones I noticed that they said Reiki Ryoho is more comprehensive than practices that fall into energy medicine category. Like, do they mean that Reiki is more comprehensive than other energy medicines, or it just felt like a weird statement that felt kind of arrogant? And that was maybe just how I was reading it, but I felt like they were kind of bolstering their stuff up a lot. They also cited a bunch of studies, but they didn't say whether or not those studies were positive. They just said somebody studied Reiki. And then this person also studied Reiki. And out of like 5 of them, only 1 of them showed some kind of benefit, or 4 of them or whatever it was. So, and then on top of that, they also made a bunch of other big claims that they only backed up with just like authors who wrote books about it and not studies about it, you know? So it felt like really sloppy and loose in that in the beginning, aside from the kind of interesting nature of the study that they did.
Yeah, thank you. Good points. And again, like the analogy someone made about Tai Chi, there's different kinds of Reiki. And, you know, some of these seem to be used in ways that are kind of basket nomenclature. Misty, and I'm going to text Amanda, who's trying to get on. So take it away, Misty.
Sarah Elizabeth, did you have something you wanted to add? No? Oh, okay. The only
Sorry, I didn't put my hand down.
Oh, that's okay. There were a lot of things that you all said. The first thing that I did was I went through the stats section and I actually made notes of things I thought that you would all like to know at some point that would make reading this stuff easier. So I'll just make a PowerPoint, won't do it now. But I'll say, kind of piggybacking off Veronica, the discussion section, and I guess Jared too, one, they didn't cite anything in this discussion section, which is my pet peeve. And number 2, this was the opportunity for them to share the importance of what they found and why it's important. And instead of doing that, they wasted the time talking about a little bit more about their methodology, which we had already read. So I was intrigued by this, though. I'm intrigued by this. As a Reiki master, I was intrigued by what they were measuring and how they were doing it. But there were, you know, as with any study, some questions, and maybe this is the first time this has ever been done. And in that case, then there's a lot to build off of. Yeah. Did you get her? Is she on?
She was trying to go through the email. I told her to go through the Moodle.
Does
So we'll
anybody
watch
have any comments on the craniosacral? Yeah, Mary. Oh, unmute.
It could be a typo, but in the 4th paragraph in the introduction, they say that people with migraine are hypersensitive to somatosensory stimuli, and it's actually hypo. And I can say that with great confidence. So that's like, touch sensation. I think what they meant to say is they're hypersensitive to visual stimulation. So anyway, just my pet peeve on that. But otherwise, I loved reading that article, and I love that PTs in Spain are allowed to at a university are allowed to do research on craniosacral. That made me super excited. So I liked this article. I enjoyed this one very much. And I can't, but I remember Veronica saying something that I hadn't even noticed. It made me realize that I need to read these more carefully, is that the sham group only got, what did you say, 10 minutes, whereas the craniosacral group got a lot longer. And they used the HDI, the Headache Disability Index, which we've also started to use. And I think that's how they determined that the emotional, they improved their emotional state, because it's divided into 3 categories. So that's the kind of cool thing about that measurement tool, is you can measure their emotional or their anxiety state going down. So I couldn't download it this afternoon, so that's all I have to say. I wish I had more specifics, but
No, that's great. And just to point out, it's wonderful. The first 2 articles were from the same journal. And now we're reading this one about a study in Spain that may have different practice standards even. I don't know if that's a fair statement or not, but that's important to notice. Where is this coming from? And again, you can kind of tell by the journal who they're directing their comments to. So, yeah.
and what journal was this one?
This one is called the Journal of Clinical Medicine,
Okay.
and it just came out. I mean, it's a 2022 piece. I see Veronica and Sacharn and Rhonda.
And
But
Deanna had hers up.
Deanna, was yours up and went down already? Okay, why don't you go first, Deanna?
Yeah, I think because my hand's tan, you're not seeing it. But anyway, so yeah, I picked up on the whole sham. That irritates me. Any kind of sham studies with acupressure and touch, because the minute you touch somebody, you're already making a difference. It's not really a sham. That's been a pet peeve of mine. But anyway, the 10 minutes versus 35. Why didn't they do the same time with that? So just to comment about all 3 articles, it felt like this one was more well written and maybe a little more structured with how it was written compared to the other 2. And so it automatically made me feel a little more like, oh, these people know what they're doing, whether that's true or not. But and I noticed all 3 of them had about 50% of their references were greater than 5 years old, which initially I'm like, well, that's not a very good percentage. But then I realized sometimes there's not enough research out there to really have that. But this one had 68 articles, which was a pretty big size, which was nice to see that. I didn't know what the chi-square test was. That was just, I wrote comments to myself about things I want to learn more about. And I also wondered about how they were planning on ruling out other contraindications like the spinal radiculopathy, vertigo, vertebral artery issues. It just would have been helpful to have a little more of that kind of information.
Great. Good. Thank you, Veronica.
So appreciating all that we've said, and there are lots of things that I thought were very positive about the article, but I think that if I can just comment in terms of when we're talking about noetic research, I thought that this was just sort of a really good example of how challenging it is to do research on these kinds of modalities, because to standardize it and to have every single person have 10 minutes of this, 5 minutes of that, whatever. And I'm thinking, can you imagine being on the table, having somebody do an occipital base release and you're done in a minute and they're holding it for another 9 minutes? I mean, that would be awful. I mean, my donkey would be so unhappy. And so to standardize techniques like that, it just to me says, this is why we can't do it this way. And I mean, I also can't imagine somebody sitting there and doing an acceptable base release for 10 minutes. Anyway, but I think you get my point. How we just really can't standardize these techniques or these protocols if we're doing holistic healing that's individually based.
Thank you. Great point. Sachin.
Yeah, so this was a pleasure to read, even though I thought, oh my gosh, this is thicker and longer, and what am I in for now? I couldn't put it down. Really wrapped. I thought it was professionally done, well communicated, well presented. I thought it was interesting that the findings were, they stated that the findings were only influenced subjectively by the participants and not by anything else. I mean, they identified that as a variable yeah, so there was that. It's question that came up for me was, how can I use the experience of this class? So it drove me to the global experience of this research class. So I was inspired to be curious about how I can use this, whatever I learn here, to dialogue with professionals in the medical field. And so just an aside, I've talked to 3 of my doctors who are like, you're doing what? Your faculty in what? Oh, it's zero balancing. Oh, well, send me something. So at least I'm doing something where they're inviting me to send them something in the words I'm saying. So I thought this was really effective. I found a typo. I didn't make a note of it. Don't think it was the same one that Mary picked up. So there may be 2, but at any rate, not much criticism for this at all.
Thanks, Sachin. Rhonda?
So the comments I have, I liked the language at the beginning that it was a randomized single-blind controlled trial. And I like that they defined that. I was curious about the longer term effects. The things that I thought about is I wonder if ZB can do a study like this. It feels relatable to me as a physical therapist and a zero balancer. But again, I'm not familiar with the statistical analysis, so I can't comment on the validity of the methods used. But I did like this one the best. It kept me interested and it made me think about, can we do something like this? Those were the only comments that I made on this particular article. There were holes in it. It wasn't perfect, but I liked it the best out of the 3.
Mm-hmm. And so Claire and then Misty.
So to piggyback on what was just said, I mean, I really felt the study was straightforward, clear. I knew where my starting point was, and I really liked that it did look at before, after, and a month out from the session. So I thought it was nice to see that timeline. And it was clear. I mean, it spelled out everything they were going to do. So I really like that part.
Mm-hmm. So thanks, everyone. And Misty, any comments on this one, or would we like to take a little, yeah, Misty, and then also, is everybody doing okay on the Moodle? Just raise your hand if you're doing all right with it, getting on board. Okay, Sheila's this, but we've seen you on the Moodle, so that's wonderful. Thank you. Okay, Misty, anything else about this exercise?
I kind of had the same thoughts as Rhonda. I'm not sure we could do exactly that whole double-blind random thing. But I did like their study design of pre-intervention, post-intervention, and then the follow-up. I liked that. And I do think it's something to look at. And then I think the other thing to remember is that like every study is in itself something to learn from. So I know when Mary and I did ours, then you're like, oh, we could do this better the next time, right? So it's always like a learning thing. So there's always going to be some things. but I liked the read of this one much better. And I don't know, my donkey was much less upset with this one than the other two for sure. And I will explain in that same PowerPoint what a chi-square is and when you would use it, Deanna.
So I think,
Claire, real quick, did you have anything?
her hand was up from before.
Oh, okay.
Yeah. Okay, so one thing that I've gained out of this discussion is that in every one of the studies that we read, questions were raised in the mind of all of us as readers about what was valid or what wasn't clear. And so we're also learning from the variation in how they approach their research topic, their purpose, their methodology, and their conclusions. And so again, as an overview, this is just to begin to lay out sort of the smorgasbord, is there is a lot of ways to study phenomenon. And some use several kinds, like the Reiki one had like 4 different things, you know, the live blood and the various scales and all of this. And it can get quite complicated. So yeah. And Sheila, did you have a comment before we go on?
I have a question. One of the things that I wondered about had to do with the journals that publish these studies. And what is their role in reading the studies and choosing which ones go into their publication or journal? That's one of the big questions for me. Somebody mentioned about the audience. Well, who is the audience for this? Are there different journals for these different audiences, I guess? So that's kind of my question. What is the overall journal, and do they review these and do they correct them? Just
Yeah,
Yeah.
if it's a peer-reviewed journal, then they should be reviewed by no less than 3 independent people that you do not know. So it's like a blind review, and they typically correct them. So it typically takes about a year to get something published. If they're giving you feedback. Now, I did not look up these journals, so I can't tell you like what their rating is or ranking. But I can tell you that it's very hard to find journals that want to publish things on like energy medicine or even maybe what we're doing. So you might be limited in where that is, like your options of turning that in to be published. So I'm kind of wondering too if that's happening. And knowing your audience, I guess whenever I'm writing a study for publication, I'm thinking about my audience, hoping it's the broadest reader and not just like, doctors or something like that. But you have to also look at what the journal expectations are, and they'll be pretty clear on that, and past publications from them, because they're going to expect you to write in the exact same way to meet their expectations and format. And that can get kind of tricky also.
And just a final comment, the comparison of these 2 journals. The Journal of Energy Psychology, do we all know exactly what that means? Not entirely, and so that is a broader kind of subject matter that could cover a lot of different things. It wasn't published in a massage therapy journal, the one on knee arthritis, and then the Reiki one was also in that. But then this last one, the cranial sacral, in the Journal of Clinical Medicine, you can almost see that they might have different kinds of standards.
Mhm.
So.
Exactly. Good question, Sheila.
So do we need a little break? We take about 5 minutes before Misty goes into the next section. Okay, so let's come back at 5 after the hour.
Let me make sure I have my thing pulled up for you guys. Okay. What is that?
Mhm.
So I want to just give you, and I just want to share, this is a really brief overview of quantitative and qualitative research, really brief. I just want you to be familiar with what they are. And I do want to say, I think they're both extremely important for zero balancing. And the reason that I think that both are important, especially the qualitative portion, is because people are in the world are not familiar with zero balancing. So if we are researching it and we're only giving numbers or quantitative data, they don't have a background yet to understand exactly what zero balancing is and what those numbers mean or are referring to, where most people have had a massage or they have some kind of idea. But if you get the qualitative portion with it while we're trying to share this research and kind of expose zero balancing to the world, as people read what's happening in a session and they get some background, they have a better understanding of reference. So we're giving them a frame of reference. And I think that's extremely important right now as we're starting. I think as we become more well-known in the world, we have the opportunity then to focus more on maybe just a quantitative study and those kind of things. All right, so quantitative research, the way that I tell my students to remember it is quantitative is numbers. So always think of the word quantity. So then you know that you're counting something. And we use quantitative research to test a theory or a hypothesis, a research question. And here we have our primary and secondary data. So primary means that you gathered this data yourself. You conducted the study and you found your own findings. Secondary means you're referring to findings somebody else found. And then the findings and everything are based on numerical and statistical evidence. What we learned by looking at these articles is that it's important to have an understanding of statistical evidence. It's important to understand what kind of tests you're going to run. So quantitative research is kind of easier to do up front as far as the planning, as long as you understand where you're trying to head and what test will get you the information that you're seeking. In quantitative research, the larger the sample, the better. So let's say if you told me something was 80% effective and there were only 4 people versus 80% effective, and you told me there were 800 people, right? Then that makes a huge difference. So you always want in an article for people to tell you the number that was in the actual study, because that gives you a frame of reference. So I'm more interested when somebody tells me 400 people had an 80% drop in anxiety than maybe 3 people. Quantitative research wants to know not why something is happening or the life impact. It wants to know how much of something is happening, if that makes sense. So it's done oftentimes after qualitative work. So qualitative work might tell you what is happening and the life impact, and then the quantitative will tell you how many are experiencing that. So they kind of add to each other. If you're going to do a quantitative study, and if you're going to work with us, well, you are, you're going to look at measurable variables. That could be age, family members, salary, weight. For us, it was anxiety levels. You're going to look at a sample size. Does it represent the population? And when I say that, the population is like the ocean. So My population might be, college students in the United States. And so my sample, which is like dipping into the ocean, has to be representative of all college students, right? If that makes sense. So I'm going to try to get college students from as many places as possible. Your data representation is well structured. So you're going to see a lot of tables, figures, graphs. Mary Behrens mentioned the box plots. So it's how you show your data. And then we're looking to see, does it produce predictive outcomes? So can we say, my hypothesis is that receiving zero balancing will drop anxiety levels by 20%. And then you really want to have an understanding of statistics, because your research question has to match your purpose. And once you write your research question, it has to be written in a way that you already know the statistic that you're going to run, because that will depend on how you write your research question. So what do I mean? Well, if I'm going to do a t-test, then my research question is going to be between groups, two groups. If I want to run an ANOVA, that's for 3 or more groups. So I'm going to word my question with the word among. So there's these slight things that key you in to what statistics somebody should be running if they wrote their question and they did the correct stat to get the answer to it. This is not the best slide, but so we're going to go on here, but there are designs and methods that I want to talk to you about. And I'm just going to give you a brief overview of what descriptive research is, correlational, causal, or quasi-experimental is the same as causal comparative, and experimental research. So if you're going to do a descriptive study, which I happen to really like, descriptive studies tell a little bit of a story. So they tell or kind of describe what is happening. So you're going to use descriptive stats. Might be something like frequencies, percentages. So 80% had this experience, 90% felt this way. And it really gives you a snapshot of what is happening numerically in a situation. But it's not usually something that you're going to infer onto other groups. Correlational looks at 2 or more pieces of data type and the relationship between them. For example, smoking and lung cancer. So here's the thing. In research, something could be correlational, where you exercise more and your weight drops. You eat more calories, your weight goes up. You smoke, so you have a higher chance of having lung cancer, but we never say the word causative. So something doesn't cause something else necessarily. Why do we say that? Well, a lot of people who smoke do not get lung cancer. And there are people who have never smoked that get lung cancer. But there is a high correlation that if you smoke, you will obtain lung cancer. But it doesn't necessarily cause it. There's too many factors there. Quasi-experimental, this is kind of what I would expect in zero balancing, more or less, because we cannot control the environment of which people live. You can be looking for the cause and effect of something, and it's carried out in their natural environment. So it could be the effect of massage on lymph drainage, Usually like a group is receiving an intervention, but we're not controlling everything. So we were quasi-experimental. Our people came in and they received something for 4 weeks. They received a treatment, and we wanted to see what happened to their anxiety levels. But it was in their natural environment though, right? We didn't put them in a lab and not allow them to take part in life or anything like that. So we can't control all that's going on. We can't control all the variables. However, quasi-experimental work can be inferred to other groups. And then experimental, which is more the gold standard, right, is you control the environment. And you're looking at 2 or more variables, and you want to understand the effect that one is having on something else, but it's not in a natural setting. It's very orchestrated and the setting's very controlled. So that's how you get random controlled blind trials. And this is one of the interesting things with the craniosacral study, when they were talking about it being random, controlled, blind, felt very controlled. But in all honesty, with that kind of modality, you cannot have controlled for everybody's environment that was coming in and what they were experiencing. So I would have been more happy to have heard the word quasi in there, but that's just my thinking at the moment. So I would say we could do correlational, and we could do quasi-experimental, and we could do descriptive. I am not sure that we would ever be what would be considered an experimental study where we are able to control for everything. So if you want to gather data, usually a quantitative study is what they say it's quicker to gather data. You could do a survey, it could have multiple choice questions, it could have Likert scale. So a Likert scale could be anywhere from, like, you see people rate something 1 to 5, or strongly agree, strongly disagree. The pain scales, I think it was Deanna or somebody was talking about using. People could rank something. So 1 to 5, what do you feel is most important? And very short, open-ended questions, very short. So you might type in a sentence or 2. You'll often see that you could use like testing drug results. Pharmaceutical companies are looking for certain effects. The measurement from PT and OT, like if you're looking at range of motion or you're measuring different things, that's all quantitative, that you could set that up. And you might be able to do some of that with zero balancing, actually. And then in this, sampling is very important. But normally for our kind of work, we use what's called a convenience sample. So it's the people that are closest around us that will partake in the study. Doesn't mean that you know them, but for zero balancing, like, we don't have a lot of money to offer people to, get them to randomly be in something and pull from all of these different aspects of life. And we don't have that right now. So we usually use what's a convenient sample. So here's some advantages to quantitative work. It's easier to do, but the work of designing a valid study is very complex, which we saw in the articles that we read. So you want to make sure that all of your design is really solid and put together. So therefore, the work is more on the front end of designing. And qualitative, the work is more on the back end of analysis. It takes less interpretation because, you know, a number is a number. You know what 80% is. You know what you're measuring. So that really speaks for itself. There's not a lot of subjectiveness to it. And it's usually holds less bias. And I say the word maybe because you want to be a good consumer of research. And if something sounds too good to be true, or something seems a little off, or a company has paid for it, so it's considered, you know, or it's in-house research, then I'm not always sure that it's so biased. And you can kind of pick up on that there's somebody's going to gain something. So one of the very important things that we do with zero balancing is we keep our research running through an IRB, through a university, and we keep it not in-house. So it's not paid for by the ZBTF. It's not hosted by the ZBTF. It's independent research where we don't really have anything to gain from it. But if the ZBTF was like hosting it or paying for all of this stuff, then people will say, well, that's in-house research. It doesn't hold as much validity. They were biased. They were looking for that to work. So some disadvantages: when you do quantitative research, you don't really have an overall context of what is happening or why something took place. So when we do like a drug trial, right? They don't tell you about the background of the people. They don't tell you about the stresses that they're coming in with, or that they have some group praying for them, right? So that energy is coming forward. There's no context. It's not great for complex issues. So if you're trying to deal with a health behavior, quantitative is probably not your way to go, because that's a complex issue. Why people believe what they do, why they act like they act, that doesn't really come through in numbers. It can be superficial with operational issues if you don't take into effect complex concepts. Again, what's happening in people's lives. And as we are assessing the data, or the researchers can be super narrow in their focus because they're only looking at one thing. They're not looking at like the whole picture and what's happening. And that's not a good or a bad, it's just how it is. And then, as you guys were really keen to point out, and I'm really super proud of all of you, is you caught inaccurate sampling, imprecise measurements. You can have missing data. So all of these things will affect your outcome of your study. I'm going to say lack of context is the same as no context. So let's take a break before we start qualitative and see if any of you have any questions or anything that you want to comment on about quantitative data and studies, like in relation to what we might be doing. Or anything that's not clear. Veronica.
So one of the things that I found when I was working in research in cardiology, which was all quantitative, was that the whole idea you would do something and then you thought, oh, well, we didn't really, I mean, maybe it's variables or something, but then you'd sort of try to narrow it down a little bit more, and then narrow it down a little bit more and narrow it down. And so if you like doing that, that's fine. But now I love seeing the bigger picture. And I found that was getting tedious for me and not really something that I was really enjoying, and one of the reasons that I maybe wouldn't even want to go back to that kind of research. Not that it's not valuable, but it's just a very different way.
Yeah, and it is very valuable. It depends on where your heart and soul is at. So if you're just wanting to see how many, is happening, or you like stats, you like numbers, then that's great. If you happen to be somebody who wants to know, but why is it happening? What's happening in people's lives, right? Then it leaves a little bit of lack and doesn't give the whole picture for you. Yeah, really good point. Deanna.
When I did a little pilot study on my own, I was curious about OT and PT measurements. So like standing reach test, a balance test. I even thought things like blood pressure would be good to measure. And so I started tracking that with some of my clients. And what I discovered is that, and I've talked with Fritz about this, is that sometimes people were, tight and restricted, and the ZB made them move with more ease. And so they had better results. Sometimes they were real lax in their joints, and then the ZB helped them to be more stable. And so their results looked like they were worse instead of better. And so it just made me realize the assumptions that I make about how I measure things. And even like things like the blood pressure, oxygen levels changed because I hadn't grounded people enough. Like I took it immediately after the session. And Fritz talked about how we needed to let people kind of integrate for a while, and that we should wait maybe half an hour or an hour. Well, I didn't want my clients to sit at my house for that long because I had other clients coming. So it just makes me realize that there's like, it's easy to think, oh yeah, I'll just do a quick measurement, but sometimes the helpful measurements have other factors like that we have to rule out. And so just to do it pure quantitative doesn't feel like we're getting the whole picture with ZB.
Yeah, and these are going to be the things that we have to address for zero balancing, where like PT, OT, if you're going to measure range of motion, or I don't know what you all measure, but that fits, right? I mean, you've done something and that's what you're measuring. That's all you're measuring. It's very clear that's what you're measuring, then that works. Zero balancing is very, I think, beautifully simple yet complex. And so that's how the research is going to have to be beautifully simple, yet it's a little complex, because we're not just doing one thing and then that, improves the range of motion, or one thing improves the pelvic, whatever you're measuring. So I'm glad you pointed that out, because that's something that we will have to discuss and be really careful about when we plan our studies and the quantitative measurements. Now, when we did the anxiety study and we used the HAM and GAD, which is about, anxiety, those are Likert scale, or they're ranking from 0 to 1 or something like, 0 to 10. And so that's like how you feel inside. We're not literally measuring a number for them. And so that fit with us at the time. And yeah, that's excellent stuff. And so the same thing goes for what, like Rhonda and Mary and those, all of you who do that. Those treatments can be easily measured, but for us, we have to look at like what is best and how long do we need to let somebody sit for 30 minutes or whatever before you take a blood pressure, or again, as you said, sometimes it looked like they were getting worse, but in reality, that's what they needed. They needed to have that tightened up.
Mm-hmm. I want to just jump in here and say something else about changes in the same client from one session to the next. You may see somebody and through just doing the session what their body feels like and the changes in it. And I'm sure everybody's had the client come back and literally from putting your hands on them at the beginning, you know, there's been change already. Their whole body feels different. How do we measure that? How do we talk about what we're picking up? Just, I mean, some of it we do chart perhaps about saying that there's an improvement since the prior treatment. But again, we're just raising so many questions for you to consider about these kinds of things.
Yeah. Rhonda.
I do think we have to be careful about the measures we use too, because it just, Deanna made me just think about something, because sometimes when I'm taking measurements, we look for ways to objectify subjective things. And one of the things I use is called a PSFS scale, and it's a patient-driven scale. They identify an activity and they rate it from 0 to 10. Well, as I work with them, they might rate it at a 5 in the beginning. Then they start to get better, and so they do more, and then they realize, oh, you know, the next time they rate it, they rate it less than that. So it might look like they're doing worse, but really they're doing more overall. And if you step back and look at the whole picture, wherein their range and strength and balance is doing better and their activities that they're engaged in are more complex, that's why they're rating this at a lower time right now. So there has to have a context to some of the ratings, and it is difficult to objectify subjective subjective things, but insurance companies like numbers, so we try to do it.
Right. And, you know, zero balancing is subjective. Yeah. So that's an excellent point. And we'll probably be pulling on many of the things that you've talked about using and seeing, can we use them or adapt them for our work? Mary Behrens?
It's interesting. I hadn't thought about the fact that quantitative is hard when you're using a modality such as zero balancing that nobody really knows about. So it doesn't really explain it. So that's really, that's kind of a moment for me right now. And I'm thinking about measurement tools. So, you know, several years ago when I first started putting people on that NeuroCom, the balance test, that fancy, you know, force platform, I remember, you know, I was so excited, you know, because I was seeing changes. But one time I put this poor man, oh my gosh, I put him on the force platform right after a ZB. And he actually did very poorly because he was still expanded. So his balance was actually worse. And then, but then a week later, after he came back a week later, and his balance was way improved, like it shot right up after he had integrated. So it's just another example of the timing. And then my second comment is just today, Deanna and I were doing demo sessions for these people, the nurses and nursing assistants that work in our employee health at the hospital. And this LPN or nurse, I can't remember what her role is, but she, you know, had foot pain and she really wanted me to fix her foot, you know, so she was all about her foot. And so did the she had a 15-minute one a couple days ago. She came back today. And yes, her foot felt much, much better. And she was very happy about that. But she had wiped tears away from her eyes. And it's like, oh my gosh, it's such an amazing, complex thing that we're doing. It really doesn't capture if we're just using like a pain scale or a dizziness scale or whatever. We're affecting the whole person. So it's making more and more sense why qualitative research is a better tool.
Yeah, or mixing them both, you know, it works
them.
so well. It's two sides of the same coin, and they're supporting each other when we can do both. Yeah, good. Sheila.
I have two things to say. One is the words kept popping to my mind, compared to what? So it would be, what are we really looking for? What is a picture of getting better look like? After I had my back surgery, actually before, they gave me all this paperwork to fill out. on scales. How do you feel? Are you able to do this? Are you able to do that? And I can tell you, I was all over the place. I must have filled it out 4 or 5 different times. And it's kind of like, if somebody were to look at this, they might think that maybe the surgery was shitty. But in reality, compared to what? And, you know, I don't feel good some days, which has nothing to do with this, but many of the questions that they asked talked about, how do you feel?
Mhm.
Well, you know, compared to what? So I was wondering if they would have given me something to look at in terms of, well, how did I answer this question early on? Then I might be able to have in compared to what? I don't know. It's just a curiosity. It's like we're trying to measure the waves that are coming in from the ocean.
Right.
So that's just it's just more curiosity about, well, it's going to be confusing. Let me just put it that way.
No, that's a good point. When Mary and I measured the anxiety, there was a time frame on that. Like, I can't remember what it was though, within the last week or something like that. So there was a reference that we understood that it was like within this week of your life, you know, or we could have given them the other scale and said as compared to, but it's always good to have a reference point so that when you're reading that, you know, internally, well, how did I feel this last week? Because I can't remember how I felt a month ago. I'm not even gonna lie to you. So it has to be a short time frame of measurement because people don't remember, and then it gets very confusing. And it is how you felt that day. But if I say overall the week, I'm like, well, I had a shitty day, but overall through the week, I had less pain. So I would mark that as less, or like a 2.
Yeah.
Yeah. Sarah Elizabeth?
Yeah, so I'm hearing Misty, you and Mary talk about this study about anxiety. And yet what I know about zero balancing is we invite people in and we set a frame.
Mhm.
So how do we consider the frame in relationship to the study of anxiety? Because the frame may not relate at all to, oh, we're here to study the anxiety that you're feeling.
Right.
And so how do we take that aspect of zero balancing and look at that as part of research?
Yeah. So we are going to cover that in another
Okay.
session. However, very short answer is we did write down people's frames, and we also did reflexive work, and we looked at session notes, and we did interviews, and that's called triangulation of data. And so a lot of times, even though their frame didn't say anything about anxiety, it was something that would have raised anxiety. So it might have been pain, it might have been a relationship, it might have been death, it might have been, you know, illness, whatever. And so you can kind of look at those and triangulate the data so that you're having like a full picture of what's happening. And that's also how you use that information to help form your themes when you do an analysis. And so that's all worked in together.
So that's all part of the design of
Yeah.
these qualitative studies is we're going to be looking at the frame. We're going to be looking at this from all these different perspectives. We're going to talk to them about it. We're going to have them do these scales. We're going to have some, you know, just writing down about the session from our point of view afterwards and design it into what we're doing so that when we get to the other end of it, we can go, oh, look, this person had this as a frame and it related this way to their life and and here's what their particular anxiety survey says.
Right. And that's why when we talk about qualitative research, I say it's more work on the back end. You still have to create a good, solid study that's valid in design, but it's easier to quickly run numbers than it is to do all of this analysis that you've taken on all of this rich data and work together. So that's why qualitative is more time consuming on the back end than the front end.
Okay.
And I just want to make a quick comment on that too, Sarah Elizabeth. we did note the frame as if you were doing a normal CB. And
Okay.
each one, there was not reference to, are you anxious today? They did all their questionnaires at the beginning. They did it after the 4 sessions, after the interview. And, you know, so some of these triangulations and this reflexivity process, some of it will come out in the study, but as I said last week, some of this is invisible in the study. However, it helps us understand the themes better. And there are always individual anomalies that you have to really kind of put some put a lot of different lenses on and see why that might have happened. And so I don't mean to muddy the waters, but just to say it's not specifically their frame was this in the study. It's taking all these things into account together.
Okay, thank you.
Good question. Rhonda.
So I guess I just wanted to make like one more comment about like it is important to look at your time frame of what you're looking at, and because there are natural biorhythms, everybody has ups and downs throughout the day, throughout the week, throughout the month, and so there's certain measurements that as a PT I only do on a monthly basis because week to week it's not going to make any sense during that up and down trend, but there's an overall trend in this direction. And so I think that's important and not everything is going to be better. That would also be a false expectation.
Right. That's right.
Um,
Yeah. Excellent. Excellent points. Do we feel good about quantitative? Ready to hop to qualitative? All right. So qualitative data is extremely valid. It is very useful, and it's often used in the medical community, especially when we're working with health behaviors or addiction, like why people do what they do, why they believe what they believe, were their needs met, did this program work? And it's usually non-numeric data. It attempts to uncover the deeper meaning of human experiences and behavior, which works well with zero balancing. It describes the lived experience. It helps develop behavioral theory, design interventions, so you can create the intervention and then measure it quantitatively later. It wants to know how, why, and what more than how many. So away again from numbers, but hey, why is this happening? How is this affecting you? What is happening within you? It makes sense of complex reality because it allows for the subjective to come in. It allows for looking at more of the whole picture. And as I said earlier, quantitative and qualitative are 2 methods of the same coin. So they're there to support one another. It's not that one is better than, but in the work that we do, it is extremely important that we do step back and get a more full picture. So just telling me your anxiety levels, have dropped from a 30 to a 2, that's great. And we did have that happen. But it was the interview of what was happening internally, and then how that lowering of anxiety was affecting their life. That was so important. And they did have weeks where I think that their anxiety level was higher, but they handled it better. And that's a big deal. So there's times that my anxiety level goes way up, and I handle it better now that I receive zero balancing than I would have in the past. So it allowed us to kind of paint and complete an entire picture, because it's very important to know in zero balancing, what are the effects? Like, what is your lived experience? How is this modality and this work changing your life, your body, your spiritual life, your emotional, mental? All of that is tied in with anxiety or anything else. So the characteristics, qualitative research is done in a natural environment, meaning we're not super controlling, we're not putting you in a lab. Many times, qualitative research, when it says natural environment, that's literal. The people are going in and immersing themselves into a culture or an environment. And they're becoming part of it so that the observer effect no longer takes place, because they forget that you're the researcher. You kind of become part of the culture. In this, the researcher is the key instrument. So where we talked about doing surveys before, in qualitative research, you're the instrument. You are giving a session. You are picking up on changes. You are hearing information. You are asking the questions. You're doing the interview. You're fostering the trust between you and the participant. So all of that is taking place because you are the divine instrument. There's multiple sources of data coming in. So Mary and I talked about triangulation. We interviewed, we had assessments, we did numerical data, we made our own notes, we did reflexivity, we looked at their frames, and there was just a lot of sources of data coming in to help us analyze what was really happening. The other thing is that quantitative data is reductive. So when you plan a quantitative study, you know what you're looking to find. So that's usually what's in your hypothesis, right? So I could have said, like, anxiety levels will drop by whatever. So I know that's what I'm looking for, reductive. Qualitative is inductive. So it's like you're in the field and you're sowing things and the tree is growing and you're seeing how many branches are coming out and what leaves are coming out on those branches. And you don't know exactly what's going to come out of somebody's mouth in an interview. You don't know what they're going to say. You don't know how zero balancing is truly affecting their life. So it's inductive in not boxing something in and saying, but it has to be this. This is our exact thing that we're measuring. The meaning of the participants is very, very important. And it's very emergent in its design. So the design sort of develops, meaning we knew we were doing qualitative, we knew we were doing semi-structured interviews, but what comes of that, we had no idea what we were going to find, what people were going to say, what themes were going to emerge. You don't pre-plan all of that. So it's really kind of exciting. Briefly, because Mary is going to cover this next week, I just want you to know these words. You could do a narrative study where you explore an individual's story and they tell their story and you share that. You could do phenomenology, and that's the essence of an experience, the essence of a being or even an object. So what's the central meaning? Our work that we have done so far is phenomenological with zero balancing. You could do ethnographic, where you understand the culture by being immersed in it, or working with a shared group with similar meanings, customs, and experiences. And if you think about the zero balancing community, we in ourselves are our own culture, we're our own group. If somebody was to come in and join us, they would have to learn like our language, our customs, the holding people in high regard, how we're about transcendent states. So they would have to immerse themselves. And then you could also do a case study, which is an in-depth analysis of a person, place, event, could be an illness. Any of these could be done with zero balancing. So I want to talk a little bit about sampling with qualitative work. And we talked about a convenience sample earlier because it's accessible. So that's the same thing that you would have in quantitative, right? You put a call out and whoever answers and can, show up for the 4 sessions comes. You could do purposive, which means you have certain criteria. So let's say, when I did my trans study on the healthcare experiences of trans individuals, clearly they needed to be trans to be in the study. So you have certain criteria, and anybody that doesn't fall in that criteria cannot be in the study. So it's very purposeful in who you're looking for. You could do a snowball, which is like networking. So someone knows someone who knows someone, and that was also part of the trans study. So back when I did my trans research, people were really, for lack of a better word, and I hate this term, in the closet. So I would be able to contact one trans person, and then they would say, okay, I think I can get so-and-so to be in your study. And they would reach out and that person would join. And then that person would say, you know what, I think I can pass this to 2 or 3 other people. And then those people, and that's how I was able to get into that community on a national level, was that they would say, they would see it on social media and they would share it with other people. And then those people would contact me, and then they would know someone else. And this is really common with qualitative research, because you're often seeking people who maybe, you're looking at asking people private things, personal things, could be painful things, just depends on the study. And so you're kind of networking out, and people will say, I know this person, I trust her, it's okay to be in that study. And then sample size for qualitative does tend to be smaller than quantitative. 1, if you have a purposive sample, that's a limited amount of people who may have had this experience. 2, it takes an enormous amount of work to do qualitative research. So for every 15 minutes of interview, it's easy to say you're going to have at least about an hour's worth to type that a 15 minutes transcript. So when you have a large amount of interviewing and you're transcribing all of that, it can become overwhelming. But for qualitative research, you've hit your sample size when you reach what we call data saturation. And that means that you're hearing the same thing over and over and not learning anything new, if that makes sense. So people are starting to say the same thing, and you're not discovering, like, it's really starting to gel, that people are all having this very similar same experience. I love qualitative research because I think it's fun. So you can do it through observation. And a lot of times I will take my students out and, if they're over 21, we'll hang at a bar and observe people. But you have to know what you're observing, right? So they have a criteria, we know what we're observing, and then we come back and talk about it. You can do interviews, but you want to be really skilled at interviewing. Focus groups, that's where you get like 8 to 10 people in a group, and you ask the question and they feed off of one another, and you record it and you get these answers. I did this with several groups of menopausal women, and they can be angry. So you would just have to know what you're doing, what you're getting into. Pictures are fun. I just received a grant where my students are taking photos of what it means to be a college student at Eastern. Document analysis, you can do video footage, and then text analysis, what people say, you're analyzing that. So it's just a lot of fun ways. And, honestly, zero balancers kind of do all of this, right? We're constantly observing people. We kind of do these little mini interviews when we talk to people. Um, people have taken pictures of people before and after. You do these little mental snapshots, document analysis. If you're writing down what happens in a session, video footage could be the same way. So we already have all the skills to do our data collection. We just haven't thought about it or put it all in one large study. Things that you might not be familiar with is how you analyze our data. We're not going to go into like a lot about this. I just want you to know these words. And it's how you set up your study. So you could do thematic coding, which is where you're interpreting patterns in the qualitative data. Mary and I do that a lot. So we will type out all of this stuff, and then we're looking for themes, we're looking for patterns. Open coding is when you add meaningful expression to, like, you take all of it and you bring it down to a single word or a short sequence of words. Content analysis is like counting how many times somebody said I was relaxed. So if we had 80 participants and we heard that 80 times, we would make note of that. Direct text is word for word. It helps back up your themes. And if you look at the studies that Mary and I have done and are doing, when we give a theme, we will often back it up by the direct quotes of people. A narrative is used to interpret their research, like their stories. So a narrative is, telling somebody's story that they've given you, but analyzing it and making sure that it's true to nature and true to what they're wanting to convey. And then discourse analysis is when you are looking for the underlying meaning or motivation for what somebody is saying. Most commonly, you will see people talk about themes and open coding or content analysis. So now you're just familiar with these words. If you read them, you don't have to know how to do it yet. Some super great advantages: you gain deeper insight. You get to explore emotions. It's more versatile. It's flexible. It allows for growth. It's inductive. People are in their natural environment. And honestly, the majority of people want to be heard and seen. And qualitative research gives you the opportunity to honor them. And they get to be heard and seen and not just counted. And that's really important to people, especially in healing work. And zero balancing is extremely powerful. So only counting them as a number can feel like a disservice to them when we've really brought them to the brink of something and they really want to share something, or they have something that they want to say. And so this gives you time to kind of get the full picture of what's happening. So here's some cons. It is time consuming. So Mary and I total have given 80 free sessions. So that's out of your workday. You're not getting paid for it. It's 80 sessions. And then you're interviewing on top of it. And then we're transcribing, and then we're coding and analyzing, and then writing. So there's no less than 1,000 hours spent on the studies that you've seen us do. That's a lot. Is it worth it? Absolutely. The work is on the back end, so you know that's coming. It is expensive. I have paid out of pocket students to help me, or you pay people $25 gift certificate to be in your study. So that kind of can add up. The sample size, if it's too small, depending on the study, if it's a case study and you're just looking at one person, that's fine. But if you're wanting to say that zero balancing is good for anxiety and you've only used 10 people, but you can get other practitioners involved and maybe do 100, you can see where that would be better to have 100. And you want to be skilled or work on learning how to moderate a focus group or how to interview people so that you allow them to speak, but you can bring them back on track if they start to wander too far off. And then there's privacy issues. And that's why we always run our studies through a review board, because they make you state how you're going to deal with the privacy issues. So if you're recording somebody, how are you keeping them safe? How are you getting rid of that information when you're done with it? How are you storing it while you're analyzing it? So there's a lot of different topics that, you know, people are sharing that you're not going to want out everywhere. And then when you're reporting it, you want to make sure that you're saying like client A or B. You're not saying, hey, Mary Murphy said when she was 16, she did blah, blah, blah. And, you know, so it's all about the privacy and the protection. And, you know, people have to trust you, honestly, to start sharing a lot of things that are happening in their life. So this is just a quick breakdown. I'm not even going to go over it. You can review it later, but what quantitative research is compared to qualitative. And it's just, you know, the data is different, the analysis is different, the conclusions, and then how you gather your data. All right, so let's take a quick stab at this. How do you feel? What questions do you have? How might you use qualitative data in your research? How might it apply to zero balancing? Veronica. Oh, unmute.
Sorry. I guess one of the things that came up for me was wondering, especially when you're doing some of the like coding and discourse, how do you really deal with your own personal bias or expectations? That seems like that would be hard.
Yeah, so the way that you deal with that one is like when you guys are doing your reflexive journal and you kind of have to acknowledge what lens you're looking through, and you do have to be able to suspend your expectations. The other way that you do qualitative research is that you have more than one person analyze it to see if you've come up with the same themes or the same happenings. And so like I do it independently, Mary will do it independently, and then you can often bring in somebody who wasn't a part of the study and have them look at it. And that will help ensure that you are suspending things, or you're not reading into something, or you're not writing exactly what it is you want to find. But you have to honor that. And many people in qualitative research, they have to upfront say their lens. So if you've had a specific experience, like for me, if I was to interview rape survivors, I would probably say, having been a rape survivor, blah, 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 because it colors everything. Even though the emotion might be past and there's just wisdom there, you still had that experience. So, and you have to be a little more honest and upfront sometimes with qualitative research, and admit, certain things.
Thank you, Misty.
Yeah. So Jared, you want to do your study, right, on psychedelics, on psilocybin. So what do you think? What do you think about interviewing people?
There's a number of things that come up. One is, a little bit of intimidation for sure. When you reference the 1,000 hours of work, I know that's for how many participants you had. So yeah, there's a little intimidation there. I also wonder about the practicalities of getting transcripts off people. If someone's talking about doing something that is Schedule 1 felony, how do you take their data? Do you take a recording of them and then transcribe that later, or do you write everything by hand because there might be some level of paranoia about recording them? So yeah, it brings up some questions around how to do that. But yeah, there's also excitement there. There's also a lot of interest in jumping in and seeing what happens.
So a couple things. One, if you run a study through an IRB, and it's for things that people may not want to sign their name to, and you're supposed to get informed consent, you can actually do a document that waives that, so their name is nowhere ever written, because that's how you do research on certain things. And the other thing is, if you were going to record, right, you would not do video. It would, just be like a phone recording, or however you record now. And of course, only using a number, 1, 2, 3. Yeah, I guess, or you might have to sit down and write verbatim what they say, but it's still in written form. But their voice wouldn't be heard. So that could be a safety measure. So those are things to look at. Yeah. But you could get a lot of rich data, I would think, for sure.
Yeah, and I wondered too about Veronica's question about bias. And I mean, I take your answer as, pretty much the same thing, but having had psychedelic experiences that were extremely meaningful to me, yeah, it makes me wonder about reading into people's experiences and sort of, seeing things that aren't there, not in the psychedelic sense, but in the
Personal
sense. Yeah.
That's a good point, Jared. And just to say, we can't take ourselves out of the research. We can't not be ZBers. We can't not have had the expanded states that we've had. We cannot take ourselves away from the clinical experience that we've observed. And so, that is something that as researchers, we would probably mention that the researchers are, and we would list our background, possibly even how long we've been doing this work or something like that. And in terms of bias, that's again where a lot of it has to be honestly done in your journal. It has to be spoken about with co-researchers, and a lot about the hours that we're talking about too. When I read my transcripts, I read them once and I start to make notes, but that's not it. I don't take my themes from that. You know, we haven't done all of the coding yet for this study, but the last study we did, I probably went through all of the transcripts 3, 4, 5 times, and different times, other things were jumping out at me. So it's not cursory, you know, you do have to invest yourself in it. And yes, you have your biases, you're affected by the experiences you've had, but you're also taking into account these themes keep coming up. This is important. Somebody's talking about something that is very significant to them. It might not be a main theme, it may end up being a sub-theme.
You can
That
also
helps.
do like a data analysis check where you can send the themes to the participants and ask, does this ring true? Is this what you meant? Is this how it, you know, did we interpret this correctly? And you can do just like the themes that you pulled from them, or you can do the whole study, right? And you ask them their feedback to make sure you're true to nature and what, you know, what you heard and the way that you're interpreting and bringing it back to the world.
And you can ask that in your consent form,
Yeah.
or even in the, if you're audio taping or videotaping, you announce that you're doing that on the tape. You ask them at the end if there's something as we review this that we would like more information on, do we have your permission to contact you, and in what time frame?
I like that. And then I assume in the study write-up, you had mentioned that, you know, these themes were pulled out of people's transcripts and then they were sent to the person to verify or to sort of corroborate.
If we end up
That you're-
doing that, yes.
Right.
Yeah.
Huh, that's cool.
Veronica?
I don't know, do you want Rhonda to go before, since I've already had a turn?
She says no.
Okay, so I was just kind of curious with all the apps now. I was just wondering if you put a transcript in and asked, could it do whatever? Identify, you know, are there themes of fear? Are there whatever? Just anyway, I think you know what I mean. Are there apps now that can do it? And if there were, how would you feel about that?
Yeah, so there are a couple. They don't do critical thinking, right? So they mostly count. So if you put the transcript in, they will count how many times like a word was said, and that can become a theme. So they can do that more quickly for you. They'll pull out, you know, you can put in certain indicators of what you're looking for, and it could pull out those words. But as far as the critical thinking and application, that's always going to come back onto the researcher. Those apps or whatever can be expensive. I don't use them because I can't afford them. But if you can, I'd be willing to, you know, give it a whirl. I just always do the old-fashioned way, which is admittedly longer, probably. But if I had a big grant, I wouldn't be against giving it a whirl. But yeah, there's a good 2 or 3 out there now. Yeah. Rhonda?
So I don't really have much to say about this because I'm not so familiar with it, except the fact that pulling themes out of things feels like it's tricky. Because are you seeing what you want to see? I like that when you commented about sort of validating back and having more than one person independently look at this. Are you seeing the same themes? You know, because there is so much interpretation to language. Yeah, that's it. It just feels tricky
Yeah,
and
it
time
is.
consuming.
Yeah, and it's like after you do it enough, I think you get to where you can do it with like a, what is it we always say? Come with fresh eyes or soft eyes or new eyes. I can't remember. There's some ZB saying. Deanna, help me out.
Mary Murphy always says soft eyes, have soft.
Okay, soft eyes, new eyes, something. Anyway, where you don't come with an expectation, right? Like when I did ours, I had no idea what we were going to find. And really kind of came into it not expecting anything, and then was like really surprised by what we found, right? I was like, wow, this zero balancing stuff's pretty powerful. And but I don't have anything to gain. I mean, even though I'm a zero balancer, but that takes a lot of practice, and I have to be really careful, and I check myself on certain topics, right? I will really check myself, and then I will have other people. So like if I was Jared, I would have somebody assess my data that like they have to be approved through an IRB too, but that had never had a psychedelic experience, to look at it and see what they pulled out of it also. And if they kind of found the same themes, or just depending on however he wants to report the data. So there's a lot of, when you get into it, there's a lot of checks and balances, but they're there. But it does take a while for us to teach it and then for you to become accustomed to it.
And it's difficult to look at such a big body of data, and you can see themes that seem to be related. Are they? It takes some sussing out. And I remember when I was doing this for my thesis, and I, the big flip charts, what different people had said and how they began to fall into different categories. And it was like a mad scientist. I mean, I had these all over the place. And then you kind of begin to recognize that, oh yeah, this is what, because you may not be saying the main theme is this, and that was the word that kept getting used, but it's like people were saying the same thing in different words about, say, resiliency, or about, say, mind was, I was interviewing a bunch of teachers, so they were saying all kinds of beautiful things in their individualized language, and then finding how to bring it down into something that really was authentically true to what they were all saying, if that makes sense. Yeah.
Dan?
I hear you talking about paying people, giving them a gift card, and I'm just wondering, because I've been thinking through this giving and receiving, exchanging energy. If I'm giving somebody a ZB for free, they're receiving something from it, and I'm receiving information that they're willing to give us. Why would you pay them? Doesn't that add a certain bias because now they're getting paid for it?
Mhm.
And so I don't know. There's just something about getting
Most
paid
people
now.
are paid to be in a study.
Are
It's
they?
something for their time. Now,
Nominally paid.
nominally paid. So $25 for, 6 or 7 hours. However, we ended up kind of having to pay people because, especially where I was at, zero balancing is not a common thing. So I'm asking people to come lay on my table and experience something they have no idea what the hell it is, but they're going to let me touch them. So it was like, well, I'm going to pay you $25 for your time. Now, once the word got out, so this next study that we do, I don't expect to have to pay people $25 because there is that exchange of receiving free work. Does that make sense?
And a research participant, they cannot pay
Right.
the researcher. I had people saying, but this benefited me. I want to pay you. I want to pay you. No, that's not ethical. And the remuneration, again, is minimal. They spent their time driving to receive the session, doing the paperwork, the interview, the follow-up paperwork. They are giving. And so, $25 Amazon gift card.
Mhm. So the first research article we read, I think she got paid by the clients she was seeing because they were in her clinic. So if I'm doing let's say Mary Behrens did a retrospective study on people she had seen in the clinic, and she was obviously paid as a therapist. So what's the difference between that? I'm not sure what I'm even asking. It just, the money thing is what's getting me in the way, I think.
Yeah, so it's so common to pay people that it's on the IRB form. How are you giving them the compensation for their time? However, if she does a retrospective study, they didn't come for the study, right? She's looking at the data past. I didn't look at that Reiki person very well, but I would have said if she was using those people for a study, she should not have been taking money for it, because that so muddies the water and is unethical. Now she could have said like she's benefiting from it because in showing that this makes some kind of change in the body, it could benefit her practice later on. I mean, you have to be honest about that, right? If we show that zero balancing does this great stuff, the plan is we will benefit, right? We're sharing it with the world, but we're also, there's a potential of building clientele. Yeah, I don't know about that. That doesn't make me feel good at all. Like if she paid participants or if the participants paid her. But it's pretty common just to, yeah.
So when people write grants to do research or get grants from like National Institute of Health, is paying the participants part of what is in that grant, so that takes it off of you personally to be investing in the research, so to speak?
Yeah, so like if we got a large NIH grant, we would say, well, we want to do, I'm just making this up, we want to do 300 people. You would write in 300 times 25 Amazon cards, right? And that's covered by the grant.
Okay.
And just like where we're not paid right now for our time because the funds just aren't there, you know, like who has that kind of money? But if you write for an NIH grant, you can write that your time is paid for. You can write that like the people that helped you gather data would receive $1,000 or whatever per person, you know, and then you receive money for your analysis and that kind of stuff. That's why you want to, yeah, you want to bring in a nice big grant to cover that kind of stuff. Yeah, because they're expecting you to compensate people. They're looking for that.
Okay. Then the other quick question I had is in terms of sample size, you said that when you start to see the same themes happening over and over, you know you have a big enough sample. Do you go in, do the research knowing you have a certain number of people you want to get for the sample, or are you saying you just go in with an undetermined amount, and when you start seeing the themes repeat, then you know you can stop the sample size?
Kind of both. So when we like fill out our paperwork, we know you have to state the minimum number of people that you're going to put in that study.
Mhm.
And you can go over it, but you have to have a minimum number. So like Mary and I knew we can only handle so many people per the two of us and still make a living and have time to have some kind of life. So did we saturate with that first study? I'm sure we didn't, right? Because we didn't have enough time to get enough people. But if you have a grant, right, you're going to say, well, I want a minimum of 100 people. And if you're at 150 and you start seeing the same stuff and you're not learning anything new, then you know you have saturated your sample, that's a good sample size.
Okay, that's good. Thank you.
Rhonda?
So I don't know if this is helpful or not, but like in the hospital that I'm in, like we see the research that's going on within the hospital. Almost all of them have some sort of small compensation, and and they are sending it out to everybody so that they can recruit more patients. If you have patients that fall in this category, or staff people, or you are the controlled bias as the healthy population versus this, and it's spelled out exactly what's going to happen and how you're going to be compensated for your time or not. But it it is a common practice, but it's never very much. Some of them are a little more generous than others. But it's usually some small time compensation, you know, you'll get a little bit for your time.
Right. Yeah. And they, when they sign their informed consent, they're told that up front in that piece of paper they sign. And like Mary and I reported that in the thing that we published, that we paid, you know, where people got a $25 Amazon card. We had a small grant from the ZBTF to help us out. And that allowed us to help people out, right? And to give them something for their time that didn't come right out of our pocket. So we were lucky there to have some compensation to help us out with that. And when we wrote them to ask for a little bit of help, we had that written in the proposal that we asked them to help them with. So we were lucky there that they were able to give us some money and help us out. Yeah. Satcharn.
Yeah, so I really am not clear about what I'm interested in doing a study on at this point. So I'm just here, I'm listening in order to be inspired. If for some reason, whatever I decided to attempt to study on pulled on the pre-existing clients that I have, how then does that influence the outcome? How would I construct a study among people who are already receiving zero balancing? And then as far as compensation goes, they're paying me for their regular session. So this is over and above that, or would I have to fire them as clients in order? So you see where I'm going with this question. So
I do.
I'll
So
listen.
one, when you write your study up, you would put in the criteria to be in it. So if you want somebody to never have had a ZB, you have to state that. If it's okay if they have had ZBs, that's fine too. So you're going to state that up front. 2, you have to suspend being paid. So one, it's going to be a convenience sample for you. So you're going to pull from the people that are around you. That's completely fine, but they can't pay you for those services. So that happened to me. And so, yeah, I lost money because they opted into the research study, which meant they can't pay me. So for those 4 sessions, you know, you can't charge them. You just lose that money. Now, if you had already put down that you were paying 25, you give them 25. If you did not say that you were giving anything to clients or to people in your study, then you don't have to honor that. So, and that's where this gets kind of, you know, I have a small clientele because I work full time. So when I lost money by people enrolling in my study, I was a little bit paunchy for a while, right? I was like, well, this is all good for ZB, but you know, it's 4 sessions or whatever.
So it's limited to those sessions. It's not like for
Yeah,
You don't
they
have,
pick back
you
up
don't
after-
have to fire them, Satcharn.
Yeah, they pick
They
back up
could, they could return after the study's over. That's okay.
And I
Yeah.
think I could probably get a huge amount of people now because zero balancing has been brought into the university. So they're familiar with it, and students and faculty and staff want it, where before I was just really building up my clientele and then, you know.
So I'm more curious about enticing my holdout massage clients who are just like, no, I'll wait till your hands heal and then I'll receive massage. I have no interest in zero balancing. So I'm wondering if I can somehow devise this to invite them to the table for zero balancing. They still receive their massage.
Yeah, there you go.
And then get more of the population around me who've never had a zero balancing at all, and not necessarily biased or unbiased, like, oh no, that's too woo-woo, I just want massage. But you know, somehow mix and match between that group of people.
Yeah, I mean, and that's a great way to do it. And the other thing I'm going to say, I had people that were in my study that had never had a ZB who became clients. So it does in some way end up balancing itself out, but you just have to be willing to know it for that short amount of time, and then they became clients. So, those that had never had it was like, oh, this is a good thing, so. We're going to do Veronica and Mary Barron's. Real quickly, I want to talk to you about a purpose. And then I know Mary wanted to take a break, but since we're at 7:30, what do you think, Mary? And then you can do your embodied.
Actually, I think it probably would be better to take these last two questions. Take a short break, come back and do the research topic and purpose. And we'll do the embodiment piece next week. We'll just move it on because I think all of this discussion has been important.
Yeah. So I think Veronica had her hand up first.
So, so I'm wondering, I mean, I understand pilot studies and I understand what you've done and the number that you and Mary could do. And I understand saturation, but I guess I'm just wondering now if you're looking for other ZBers to contribute to the database, would there, based on, I don't know, would there be, just in terms of sampling size, I guess, would each person who's participating need to do a particular number, or this is just sort of specific to your study, but also just sort of in general in sampling, if you're expanding, how would you know how many people each new practitioner would need to do?
Yeah, so that would just be something that we would say, we need you to do a minimum. So maybe let's just say we need every practitioner to do a minimum of 3. And then if somebody says, hey, I have time to do 8, that's fine, right? Because we're looking for a collective, but we need to say, hey, we need a minimum of 3 people, or we need a minimum of 5. If you want to go over, that's great. But just signing up and doing, 1 is not as helpful as, if we could get 3 or 5 per person. As far as like saturation, we're not going to know until we get a larger number of people and see what happens.
And I don't know, what would help you determine how many people each practitioner needed to do, just as a researcher?
So in this case, as a researcher, like, let's just say that we wanted 100 people. I'm just pulling this out of the air. I'm not saying this is what it is, right? And then like 10 people offered, right? So we would maybe divide that, or if somebody said, I literally cannot afford to give that, but I can give, the 3 minimum, then we would accept that, because the other thing is we're not here to bankrupt people to gather, data for us. So some people would have that time and the ability to do that, and other people, we'd have to say, hey, to even sign up, we need you to say a minimum of 3, and knowing that we might not hit the 100, but we still have more than what we had. And the reason that I say that way is because we don't have the funds to pay you. Now, if we had a large NIH grant, we would set a limit and say, to participate in this study, all practitioners, right, saw 10 people, but you're being reimbursed for those 10. So that's a fair thing to ask. But when you're asking people to contribute of their time and perhaps a loss of income for 4 or 5 people, then you have to just kind of go with that.
And I understand not being paid, but would it be ethical if they really felt that they wanted to contribute? I mean, like, they could contribute to the ZBT TF, right? If they wanted to, if
We're not assuming that the ZBTF is going to be in a position to grant large sums of money for any of this yet. It's not an assumption that is possible to make, because we are a small organization, and the ZBTF works very hard administratively to do many things worldwide, but they do not have the deep enough pockets to fund all of us to do this. I think we need to be realistic about that. And Amanda, jump in if I'm not conveying this appropriately. But I mean, that is one thing. And the other thing is that we want studies that can be institutionally review board approved. So the example that we're going to put you all through about designing a study doesn't necessarily mean you're going to be able to implement it unless you can get it reviewed in a way that would make it publishable. Is that right, Misty?
Yeah, but are you asking if somebody could donate money to the ZBTF?
I'm just, yeah, it could be anything. If they just wanted to make a donation in honor of what we're doing without any expectations of anything in return. I mean,
Yes,
that would be ethical for them to just make a
that would
donation.
be wonderful.
Okay, thank you.
Amanda?
So I really appreciate this conversation. And I think this just shows how much education we all need around this, around research. And one of the questions I have is that if the ZBTF, which I would love to see, have enough money to offer a grant to independent researchers, doesn't that constitute in-house research? So that's my question. Like, if the ZBTF is providing, saying, oh, Mary Behrens is doing a really interesting study on X, Y, and Z, and we want to support her and give her $500 or $5,000, doesn't that, where does that put us in a difficult position to say we are swaying the, you know,
Results.
Yeah. So that's where you're better to like fund a smaller amount. So if somebody says, you know, my whole study is going to be $5,000, or the ZBTF comes and says, Misty, we're going to pay you $5,000 to do this study for us, then, and I'm on your research board, I'm on your ZBTF, I'm on your, all of that stuff. I'm on everything. That looks a little fishy, right?
Right.
But your mission is to honor research, right? And support research.
Yeah.
So let's say it's Mary Behrens and she comes and she writes a proposal and you're like, we can give you $1,000. You know, we're supporting research. We give you $1,000 towards this 5 or something like that. Then you're meeting your mission and she sought from you. But if you come to me knowing that I'm on absolutely everything to do with research, right? I shoot myself in the foot because I want to actually apply for money if you have it. But that's why you've heard many times, for those of you who don't know, where I will sometimes pull back from stuff that has to do with research and ZB, because I don't want to be labeled on the ZBTF board. I don't want to necessarily be labeled on the research board if I am doing this information right now, these studies, right? Because I don't want people to be like, well, she's just their in-house researcher. If I was to stop doing studies and just be a, you know, serve on the research board or something else, that would be different. So it's like all about, one, honoring your mission. 2, if you're opening up and you're saying, hey, we have grant money, but you have to apply, that's a whole different thing than looking for somebody saying, we're going to pay your stuff, and they serve on absolutely all of this different, so enmeshed in the community. So,
you know, I would argue that we're all pretty enmeshed in the community.
yeah, I mean, we're a small community.
Yeah.
Supporting somebody with $500, if you open it up and you're taking grant applications, that's a whole different thing than seeking people out. Does that make sense? And
Yeah,
like,
no, I do. I think that's good. And I mean, I appreciate you bringing that up, Veronica, because, you know, one of the things that people want to give money to, as you know, when they're donating to the ZB Touch Foundation, is to support research. And so, you know, we've just come, so we're exploring ways that we can do that in a way that is ethical and valid and makes sense. So that, you know, that's one of the main reasons why I'm here, to learn about the different types of research and also how we can work together.
Yes.
And down the road, the day may come with plenty of money available to the foundation where they could actually institute their own, they could establish their own institutional review board with well-trained researchers who are capable of analyzing projects that come in. We'd like to do this research study. And there would be people well-trained enough to do what we were doing earlier this evening, which is look at the study's validity and all of that kind of stuff. We're not there yet. It's important for all of you to realize we are taking baby steps. We are building a foundation bit by bit, and we're hopeful that just even in these 6 weeks, we can expand everybody's understanding of what is involved in research personally, professionally, and really, have a grounded idea of what's involved.
Mary.
This is making me wonder about what's out there with the craniosacral research, because my impression is they've done a lot. So that's thing one is I'd like to look into that more. But in terms of samples or our population that we study, I know we have to sometimes use a population of convenience, but does it add validity if the participants have never had zero balancing? That's one thing I've always wondered.
Mhm.
Yeah, I mean, I think it depends on the purpose of your study, right? So if don't let me misspeak, Mary, but I think for one of our studies, we didn't want the people to have ever received a zero balancing session. And that was one of the requirements. But if it depends on your research question and your purpose, whether you
Yeah.
would want people to ever have received a ZB, or it's okay to use people who have already are familiar with it, but you're deepening your knowledge of something that's happening. So it all is going to depend on what's your purpose, what's your research question, and then from there, who do you need?
It's
So
a
what
good,
parameters?
it's a good point, Mary.
Because it
And
feels like it would be implicit bias towards CB.
Yeah, of course it would.
Yeah.
And that is true. And at the same time, there's implicit bias in any kind of research, whether it's acknowledged or not.
Okay.
Okay, and you can design a study that would be, I don't like this term, but they would call it naive subjects. Somebody who has never received a zero balancing would be considered a naive participant. So they have no expectations, anything like that. On the other hand, when you're looking at something like in our first studies about the dimensions of wellness, we want to know and gather this thick and rich description of how people are being affected emotionally and spiritually and these other ways. And we felt if you were a naive subject, you're tracking the practitioner the first time, maybe the second time, whatever. That's different than somebody who's received some body work. Some people had never had a ZB, but some people, most of them had. And so it depends on the criterion you set. And if you want to get very particular about that because you want to measure that, that is one thing. Again, all of our studies to date have been small. They've been pilot, small samples, feasibility studies, beta testing, experimental testing.
Mhm.
So these are all questions that could be built into a larger study. Does that does that answer the question?
Yeah.
For our first study, we said if you were going to be in it, you had to have had 2 zero balancing sessions so that people would drop in and not do as much tracking. So sometimes we gave 6 sessions instead of 4, so that if somebody wanted to be in it, and we did that so people would drop in, because the first 1 or 2 times that you're tracking everything, I'm not saying nothing is happening, but we wanted them to just drop in and have the full experience. So we consciously made that decision that those were the parameters and why. And I do think we stated that somewhere in the methodology that was
Of the first study.
the first study. Yeah.
Okay. That
In
makes
the
yeah.
second study, we have both.
That makes sense to have it be standard. Yeah, so maybe they've had 2. I see. So they were quote naive, but they'd had 2, and then they could participate and have 4.
They were not all naive. Some had had more than 2.
Oh, okay. But they'd had at least 2.
Yes.
Okay. Okay.
So
I think we should go on, Misty, to the research, because this is something that we want to talk about. Have you discuss on the discussion board?
all right, so we're not going to spend tons of time because we don't have it, but for those of you that were in the TT5 training, this should look familiar. First, you have to select your problem, and then you're going to write your research question. So that's where we're at in this whole process. We're in these first 2 things right here. And then we're not going to worry about this right now. So the first thing we're going to talk about is your problem. And you can look at that later. So first of all, to pick a topic, make sure it interests you. Make sure that you have the time and resources available to complete the study. And so when I'm sharing about like the time that Mary and I put and the cost or whatever, that's not a complaint. We realize that we're doing this because there's no resources right now, but we had to make sure that we had the time and that we could give that much time and still be okay financially. And then make sure that you've created a study that you can manage because it can get really out of control really fast. And so you want to watch that, and that it actually contributes to the field in some way. Make sure when you pick your topic that you are aware of your own values and prejudice. So what are your lenses? Is it something that you can research and be fair about it? Make sure that you have either yourself or you're working with somebody that can help you with a methods section so that people aren't shooting holes in it. You want to watch for the reactivity of the participants. So what I want to say about that is like, make sure that it's not causing harm, that there's more positive than negative. So we have to answer that question for the IRB. So you have to, what are the benefits versus the risk? What is your time frame? And then budget. So what I want you to think about, what topic might you want to study? Link to zero balancing. Who might your subjects be? So like, if I wanted to say something like, how does zero balancing aid women with menopausal symptoms? And then my subject, of course, are going to be women in menopause. Where am I going to get my sample? Like, am I going to have a convenience sample? How many people do I think I want? Those kind of things to help narrow down what you might want to be doing. So that's why we're covering this slide right now. That's part of what we want you to put on the discussion board, is what's your topic and who might your subjects be. And then we want you to write your purpose statement. So it's only a sentence or 2 long, and it is your frame for the study. So if I came and said, what's your frame for the session? Your purpose statement is the frame for a study. And what it does is it tells people what you're doing. So you're clearly defining exactly what you want to do. So who you're doing it with and what you are researching. So here's one for our mixed methods, and these are just examples. You can look back on them. But the one that Mary and I had is, one, is it a qualitative study, quantitative, or mixed methods? So state that. So this mixed method study is one of the first of its kind to examine how the intersections of dimensions of wellness and the impact of ZB. So that's ours. That's our purpose statement. Many people will say the objective of this study was to, or the purpose of this study was to. Mary and I just chose not to use that exact wording. So we wanted to know how our well-being is influenced by receiving conscious and transformative touch. For this one, the purpose of this qualitative study, so now you know they're doing interviews or something, is to describe the career development of 18 prominent, highly achieving African-American, Black, and white women in the United States across 8 occupational fields. That's like a really dense purpose study. They were very clear. And their aim is to explore the critical influences on the career development of these women. I would have written something like, the purpose of this qualitative phenomenological study is to explore teachers' perceptions on student discipline. It is straight to the point, you know what you're doing, and it just tells the reader, this is the purpose. Here's the thing. This purpose is now your guiding light for your entire study. So whatever your purpose is, your research question must match it, and the stats or analysis you're going to do must match it. So that's why it's so important. If you're going to do a quantitative study, you want to name the variables that you're measuring. So the purpose of this study is to determine the strength of the relationship, that'd be a Pearson's R, between height to weight among female undergrad college students. So the variables are height and weight. The participants are undergraduate students. The site of the research is Northwestern. Now, you might not know all of this kind of stuff, so you can be very vague starting out on this purpose statement on the discussion board. So if you just want to say the purpose of this study is to examine, or the purpose of the study is to explore how zero balancing can support menopausal women, boom, that's fine. We're just starting. You're just like getting your feet wet on writing it. So what's your topic and what do you think the purpose is? You're not being graded on it. We're just laying it out there, and you're going to start to get feedback from other people. That's it.
And it is an exercise.
It's it.
It doesn't have to be designed for an actual study you're sure you're going to do, because really this is just to get practice with doing that, and each one of you will then be able to learn from each other how you're taking a topic and you're defining your purpose, and then we'll be able to go through it together.
And just make it one sentence even. So like my students at school will say, the purpose of this study is to explore college students' attitudes, knowledge, and behaviors concerning binge drinking. That's it. I know who you're looking at, what you're measuring, and your topic. That's it. Very simple, one sentence. How much fun is that? I can't wait to post my own.
So this could be like a brainstorm session for ourselves.
Yep.
So we
And-
could have, you're saying come up with one, but we could like throw out a bunch of different ideas.
Yep.
Okay.
And
You could, but pick one to write your,
thing
if
on.
you have a bunch of topics, pick one to write your purpose statement about.
Okay.
And the fun thing about the discussion board is allowing the feedback of other people. And people might say, oh, that's a great topic. Have you thought about using it with this sample? And you're like, oh, that's a really great idea. Or have you thought about narrowing it down to this, or widening it to that, or adding this? And that's the fun of the interaction and working with other people when you research, is just getting that really exciting feedback and interplay with people. Yeah, Rhonda.
At some point in time, not tonight, I'm a bit saturated, but will we talk about like incidental findings? Because the purpose is this, but then there are sometimes incidental findings that occur with a study as well.
Mhm.
Is that
On down the
something
road,
that we care about? Yeah, yes. Okay, thank you.
on down the road. But yes, it is something you would care about.
Yeah, I mean, the incidental findings, you know, you can have your main findings based on everything, but this incidental finding might be really interesting.
And it might be really important.
And it might be really important. So there is a section in the discussion where you do bring your own thinking and prioritizing of why this might be important. You can report that.
Because just I know in general in the literature, there are some major findings that happen to be incidental to a different study.
Yeah,
That's right.
You know, like, yeah.
Exactly.
To the study original question. Yeah, okay.
Good question.
Yeah.
Ronnie?
Sorry, earlier you said that it had to be, when you were talking about yours and Mary's, it was something that you would be able to do. I'm not clear. Is this something that we would be actually able to do, or it's just an exercise to do a write-up?
This one would be, I would tell my students, you can dream this up as though you had no limitations.
Just knowing that
can-
just knowing that the reality is that we do have
that we have limitations.
limitations.
But it's more fun to dream. I mean, it's more fun to put the magic in it and think, wow, if I could do anything, this is what I would do. That's where the juice is at, you know. So,
Can I ask like a sideline question?
yeah.
Here we are in this set of conversations around research. I don't know about any of you, but I don't have a degree in research. So when somebody looks at who's written this and who is this Sarah Elizabeth Anderson person who's written this research study, and she has no research experience, like what kind of clout are they going to put to me? How much
Do
are
they
they going to be?
have research experience? They don't.
Yeah, well, this is what graduate students do, Sarah Elizabeth, and undergrad and so on. They're emerging researchers. That's what it's called. And, you know, in this case, part of the end game here, if you will, is that going through this basic overview prepares you, you know, going through this exercise prepares you. And along the way, at the end, if we wanted to replicate the study, we can tell you what it would take for you to participate with us in replicating the study. Not that, you know, all 16 of us are going to go out and do 16 different research projects. No, the practice could come in participating as a clinical researcher meeting. You would do the sessions, you would collect the data, you would give the data to us, and we would analyze it. But it's a practice of going through it. And that's how you build your chops. You don't go out and design a study and just boom, do it with no research background, you know.
Well,
and we're not trying to be daunting. We're just trying to tell you the truth.
And
Yeah,
so
no.
if you're asking like what's behind your name, you know, or something like that. I mean, you know, you're an LMT, you know, all of that kind of stuff, a certified ZB faculty that holds, you know, weight. You can say you've been some kind of research trained and introduction to research. You can say you're a field researcher after you've worked with us. So there's a lot of ways to, you know, get your practice and work it up. And, you know, I know a lot of PhDs that don't understand research. Just let me be honest with you. So it's, I know that looks impressive behind a name, but there's a lot of people that they don't get it. And there's a lot of my students that are real skilled and they don't have PhDs. So it's just all about, you know, getting your training and building up your knowledge.
And anybody who wanted to participate in the study would be given the opportunity to take an ethics course through the university, through Eastern Illinois, so that you could be allowed to be as part of the study and and everybody would have to submit their background, including their degrees and so on.
Yeah, but the university has never kicked back and said, well, Mary doesn't have a PhD, right? They're just like, is she trained in what you say you're going to do? And she is trained as a certified zero balancing. She's done this long, she's faculty, and that's what they're looking for. And do you hold your license under to touch? So they're not, and the other thing that I will say, EIU said, one, if people wanted to be on this study as researchers, they would cover them ethically if they had had some sort of research training, which is why this class is good. And two, they would offer the ethics test for free that people have.
Ethics training, yeah.
And so like where normally you'd have to pay the NIH $75, EIU said, we will offer that to your people for free if we know you offered them a class. So they're just putting this trust out there, right? And so you would do that, you would take their test for free. It's really easy. They give you all the information and then you just answer the questions basically till you get them right. And then they just ask for your license and like maybe your ZB certification or something like that. Amanda.
The NIH training, this sounds like a great opportunity. Is it like Red Cross training? Does it expire after 2 years? Is it good for a while?
So the NIH training is the same as the EIU training. It's just that like if you're a part of the university, it's free.
Okay.
So it's the same kind of ethics training for research and it lasts for 2 years.
Okay. Thank you.
Mm-hmm. And even I take it every 2 years. Jared, did you have a question?
Yeah, not so much a question, just a thought that it's really common in the mushroom world for citizen scientists to be doing real research. And it doesn't matter if you have a PhD, if you find a new species, you did the thing, And I feel like to some degree, that's what it is with us. Like if we do a study and find something interesting and it's replicable or it's meaningful or it pushes the needle, then cool, you did the thing.
Yeah, and everybody in this class is already, in my view, not only a clinical practitioner, but a clinical researcher. And you would be quite capable of collecting the data, putting the whole study in your laps and saying, now write it up, analyze it and write it up and do all that. That's not what we're asking you to do. So just to be clear about that.
But if somebody wanted to help and learn that process, we're not against it. It's just not that we would throw it all at you and be like, you're on your own. Anything else? We're at 8:05. You guys are great. You blow my mind with what you picked up in those studies. So thank you very much. And just your research purpose and your research topic on the discussion board. And next week, we'll talk about embodiment and culture. So,
And if we get to it, maybe a little bit more about qualitative.
Yeah, for sure. Thanks, Mary.
Thanks, everybody. We appreciate this and all of you very much.
Thank you.
Thanks
you're
so
welcome.
much.
Very much.
See you next week.
Have a
And
good night,
Deanna,
everyone.
real quick, right? If you're an OT and we write you a letter of completion, you can get CEUs.
Correct. For this class, yes, please.
Oh, cool.
Well, I might want you to do one for PT in New Hampshire because they've accepted everything I've ever thrown their way in ZB world. So why wouldn't they?
Okay.
Anything we can show is going to benefit us as a practitioner. I think OTs and PTs pretty much get covered. So it would be helpful to have something like that.
Yeah.
By the way, I'm not going to probably be here next week. I'm going to be in California with my mom visiting my aunt. I don't think time-wise it's going to work out, but who knows? I may try to at least touch base via phone a little bit, but I'll have to catch the recording.